Hello, my name's Dean Boyce. I'm a consultant plastic surgeon across South Wales, but mainly in Morrison Hospital. My private practice is based in Sancta Maria.
I've been consultant for 23 years, but in plastic surgery for probably about another
8 years before that, so in total over 30 years. I first came across plastic surgery when I was a medical student, but you weren't really routine exposed to it. And so I sort of put it out of my mind and traded general surgery, and then pang to do plastic surgery back on my mind. So I just did a short job and really enjoyed it, and then stuck at it. In Sancta Maria, most of my practice is obviously cosmetic surgery, and common procedures I probably would say body contouring, things like abdominoplasty, breast surgery. Quite often these days, people have lost a lot of weight through a combination of either surgery, just self-will, or sometimes with the help of things like Mounjaro and Ozempic. And once they've lost the weight, obviously the shit changes, and they still have the body that they want, even if they've lost weight. So often you can help them with that.
The most rewarding part is seeing people pleased afterwards. With patients, you have to be realistic. You can show them befores and afters, pictures of similar patients. And then, seeing them afterwards when dressings come off,
seeing them happy is obviously very gratifying. Yeah, I mean, it's interesting. I'm going to a meeting I was invited to speak at a meeting in Jamaica. In Jamaica, it's very fashionable for ladies to have very big bottoms. And so they used to inject fat into the bottoms. And that wasn't the case in the UK at the time. As you say, there was a tendency for ladies to like that look as well. That was nurtured by media stars and celebrities. People see these things on screens, and then they think, oh, I don't like that. So certainly the Brazilian butt lift was something that was offered in some centres in the UK or by some practitioners, but it's been pretty much banned now because of the risks involved in the UK. People do go abroad to get it, and people still have really bad complications from it, from most sort of surgeries abroad, but thankfully not often now in the UK. Yeah, I think people can be fooled by the promise of a week's holiday and an operation and coming home, but obviously there are risks involved in that. One of the major risks in surgery is clots in the legs and lungs. In an operation, it's not like buying a new set of clothes. Complications occur from long operations and also from long flights. And if you have an operation and a flight, then you're pretty much doubling your risk of getting quite a serious complication. And obviously, when you do get a complication, because complications do occur very occasionally, then your surgeon's a long way away, and you have to seek advice more locally. And that's going to cause more costs for yourself, because you end up paying for your operation abroad and probably having to pay for an operation at home as well to correct the issues. Plastic surgery is a specialty that depends on specific techniques, tissue handling, microsurgery, and adapting those techniques to our own different parts of the body. A lot of what we use is just microscope and stitches, and there haven't really been that many advances in that in the last sort of 25-30 years. What we do with microscopes, we've got a little bit more intricate. 3D operating is now coming in, robotic surgery for microsurgery. I suppose in cosmetic surgery, then trying to image somebody before and potentially what they can look after your operation can be helpful for somebody. And there are always new techniques for different procedures, but to be honest, most of the techniques that I've used over the last 25 years are still the same as I used them 25 years ago. It's just that you adapt them and you learn and you adapt your technique to different scenarios, different people, different bodies, in order to get the best outcomes. Well, in the UK, you need to be on a specialist register to be a consultant plastic surgeon, but I think anybody can call themselves a plastic surgeon or a cosmetic surgeon. I think any doctor, whether he's qualified in the UK or abroad, can market himself as a cosmetic surgeon. There are no qualifications on it. The only qualification in the UK really is if you're registered as a consultant and have gone through a registered training program. So it's a common misconception when you see cosmetic surgeon, it doesn't really mean very much. People need to look at qualifications of the surgeon that they're considering. They need to make sure they have an FRCS Plast or equivalent, which is the higher specialist qualification of plastic surgery in the UK. They need to ask around. They need to ask their GP, do the research, and you've got to be very careful because there's some very glitzy websites and Instagram pages at the moment that can be quite confusing. So personally, most of my patients are word of mouth patients. I don't have a huge Instagram presence. I do have an Instagram page because gives people options. It shows people what can be achieved with surgery realistically without any glitz. The actual term plastic surgery comes from the Greek word plastikos, which means to mold or give form. A lot of people think you should be using plastic. There's no plastic aboard plastic surgery. Plastic surgery basically is reconstructive surgery. Obviously, cosmetic surgery is a form of reconstructive surgery, and that's what people associate with plastic surgery. But generally, plastic surgery is also involved in all sorts of things in the NHS, like cancer, reconstruction, and using the same sort of techniques that use in cosmetic surgery and applying to a different setting. So I suppose it's a very broad specialty that uses some specific techniques to apply it to any part of the body, really, to improve function and appearance. I'm Dean Boyce. I'm a consultant plastic surgeon at Sancta Maria Hospital. Please feel free to reach out and get in contact should you require any further information.